Hi, Dr. Stephanie Waggle here, and today is the final round of interviews. So we interviewed about 40 students, and now it's down to the final 16. So we will see what they have in store for us. Would they get into medical school if this were a real medical school interview? Stay tuned to find out. All right, so here are some definitions that are very important. Make sure you know the difference between empathy and sympathy. Empathy is more of your ability to share the other person's emotions, where sympathy is compassion or it could be pity for somebody else. Capacity is very important. It's determined by a physician, and it is a person's ability to make a decision, particularly in the medical setting. Competency is similar, but it is decided by a judge. Autonomy is the right of the patient to make their own medical decisions, and informed consent is very important. It's when the doctor teaches the patient about the risks and benefits and what alternatives there are to their treatment. And beneficence is the duty of a doctor to act for the benefit of the patient. I was alone in a small room with a telephone ringing with two-way mirror to see if I would answer the telephone. Oh. So expect the unexpected, my friends. Really? Okay, are we getting a good angle?
Yep.
All right, so just because I'm giving you feedback and it's going to be online, I'm just going to address you by your first initial as to not call you out. So the individual whose name starts with a B came in late, so they didn't get to have an interview. So the feedback there is don't come late. Uh, let's see. E. You could have jumped in more, but I understand that you're young. I did like that you said as long as there is a percent possibility that the patient could live, because I asked if there was like 20, 80 or 60, 40, and you said as long as there is a percent, and I like that. Your justification for the ethical, seemingly negatively ethical thing that you were doing to justify doing it was actually better than what I had said in my head about being ahead of the disease. I was thinking, oh, maybe bringing back the disease could help find cures for other diseases, but I actually like your answer better than my own answer. And then I like that you mentioned chinchillas. You pointed out that the AI wouldn't get sick. Well, I guess it could get a computer virus, but I like you point that out. I like that you compared the space travel and spacecraft to a flight, how whenever you're flying from one place to another and somebody gets sick, they do just kind of land in the closest area. I like that you brought up the capacity, because when somebody's making important life or death decisions, you need to make sure if they're mentally. So, competency is determined by a judge and capacity is determined by a psychiatrist, but either or, that's an important thing. You want to make sure they know what they're saying when they make those decisions. I like that you wanted to warn the hospitals on Earth ahead of time. You don't want to just bust in and be like, surprise, and see if, in order to discover if the virus or the disease was from the space travel or could have been implemented prior. You said contact the patient's previous contacts on Earth, because maybe they're sick and that would imply that it wasn't from outer space. And interviewee J. Remember, this is a mistake everybody makes, is diagnoses. It's fine, nobody says that right. Delegating tasks. You were the first person to actually, because I kept saying like y'all need roles, right? So I like that you bring up delegating tasks, and also PPE, because you're the first to point out that like, what if whatever's going on is contagious, and to tell them the truth. This is a very sticky situation in medicine, because in my experience there have been a lot of attendings that I have shadowed that did not tell their patients the truth. So I think honesty is the best policy. I mean, of course, there's always like rare situations where you may not want to do that, but in general, I think you probably should be truthful. You were the first one to get my point about like what can you use, and you said, oh, there's AI on board. I would say that out of the whole group, you're the leader, and so because you delegated whose tasks go where. I always think about the show Lost is like about a plane crash, and it's like I feel like I would definitely be the one to like start taking charge because I'm like so type A, right? And that may or may not be a good thing, but you would be like me, the leader in that situation. And then I think that the going back to Earth was your idea because you know that there's hospitals on Earth, whereas like we're not really sure if there's hospitals on Mars. And then you brought up the fact about do not resuscitate. So you know, if somebody's about to die, you need to know what their wishes are for that. So, great job, everybody. And just so you know, everybody got back to Earth. You were able to instill the research about the disease to prepare for the future of space travel. The bomb did not go off. The AI also didn't do anything wrong because it just thought it was doing the correct things. And you lived, Jade. Woo. Yes. Congratulations, everybody. You all lived through your interview.
Am I allowed to show them or? Like, can I show them? Because you gave feedback or what?
Yeah.
Okay. Yay!
But we don't know who's who.
You don't know who's who. Sorry.
Oh, yeah,
Yeah.
that's right. I'm putting this on YouTube, so I don't want to SF. We're just doing initials. Okay. Out of everybody here, I thought that you actually came up with the most. I have specific points in my head that I'm looking for, and you hit the majority of them. So, I don't know. I don't have any candy, but good. Specifically, capacity. That you brought that up, and that's kind of my gig is the capacity. So, thank you. You did also bring up, does the family have the finances to get there? How to do it, you picked out like, okay, this is a sort of rare treatment. Wouldn't that imply that not many people can do it? Yeah, it does. So that was a good question. You were the first one to bring up legal, which in my heart, CYA, I won't say what it stands for, is near and dear. So that's super important. But also, stick a pin in that because when we get to Carter, I have that it's not that important. It's very important, but not that important. Caretakers for home, does it cure, does it treat? I mean, yeah, there's a difference between something curing something and something treating something, so that's a differentiation that is vital to make. And then trying to get the doctor that already did it successfully to perform it here, that's a genius idea. And then I think at least, well, Miriam was the fake patient, but at least for me, hearing that I have my whole life ahead of me was like what really made it the decision to go through with the treatment. So, yes.
Thank you.
All right, and your T, we're not gonna say names. What you brought up, what does the family want? And that's definitely something I was waiting. And how old is the patient? Yeah, super important. I'm glad you brought that. What if the patient was like 3 days old, you know, or what if the patient was 106? That would have changed the whole thing. So I'm glad that you brought that up. And then you talked about waiting to see if the treatment cures more people. I thought that was an interesting twist. It wasn't one of the things that I was thinking of, but I was like, yeah, that's a good point. Like, what if we can stall it and then it cures more people and then maybe it'd get an FDA approval? And then what country, even though I didn't want to call out any countries or get political, I never said the country, but that is a good question. And A, you brought up like lifestyle and how they're living now, and that's important, especially when judging things like capacity and somebody's decision. Like sometimes people just want to be left to die, and something that nobody brought up is like a DNR sort of thing, although you did bring up power of attorney, I think. And so their ability to function at home, like, okay, let's say that they got even 2 more years, but they're like getting bed sores because they can't move and they're absolutely miserable. Like that would be an important factor. So I'm glad that you brought that up. And C over here, I think that out of the group, you would be the leader because you were the one to make the decisions. However, I'm gonna advise you to don't make the lawsuits affect your medical decision making. CYA is incredibly important, and I said it is near and dear to my heart. I meticulously document every single thing, but if what in your heart medically is what you want to do, don't not do it because you're afraid to get sued. I mean, obviously you want to avoid getting sued, but you got to stay true to yourself. And then bringing up the option, and you were like it depends on what specialty you go to, because some specialties you definitely like are a quick decision maker, and that's important. If you're in the ER, then that's fantastic. So that's definitely you can't sit and loom over a decision, because people will die in the meantime. So that's good that you were pretty much like, this is what we're gonna do. Like, somebody's got to have a leader. So letting the patient decide. Yeah. So you push for the procedure, and in the end, the ethics committee convinced the patients to get it done, which I personally think was also the right decision. So
Yay!
All right, guys, you're dismissed. I think, that would be maybe a time where that would be acceptable.
Like cyanide pills, secret agents have.
Yeah,
those.
exactly. See, nothing is black and white and straightforward. All right, so we're rolling with the
go ahead.
film is rolling. Okay, I'm just going to do initials. So V. And I'm pointing out things that I myself thought about, and I sort of wait around for people to say, like, for example, like, what does the patient want? But so you said, what is normal in space? So I actually did a lot of space medicine study. I'm actually published in an Air and Space journal, and so there's like a phrase about whenever you study, it's also associated with oceanic medicine too, like space medicine. It's like when you're studying humans on Earth, it's like it's abnormalities in a normal environment, but in space and in the ocean, it's like normal people in an abnormal environment. Mm-hmm. And so when you said, what is normal in space? I was like, that's like the motto. And then I like that you took vitals on everyone, because we did this prompt, not for the last group, but the group before. Mm-hmm. That's good. Nobody took vitals on everyone, because like, what if the doctor, who ironically is also the patient, which could get very confusing, his vitals are abnormal, but because they're in space, those are actual and normal. So having a reference point, that was really good. I had a harder time with this group than the other two in deciding who the leader would be, because first I thought it was Molly, because she spoke first, but then you were the one that said to delegate leaders, and usually leaders are the ones who say to delegate leaders. So I'm unsure. I like your distrust. I don't like distrust, but honestly, for me to trust someone or something in this case, it's got to really earn my trust. So I kind of liked your distrust of the AI, and then your option to disarm the bomb. I mean, I feel like that didn't come up before. People were just letting it tick, 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 tick. So those were the points that I liked there. And M, and then we have 2 M's. So M1. I like that you were the first one to talk about like teamwork, because the prompt, and every group did this, like they talked to us, but the prompt was like, you guys are on a team and you talk to each other. The last people, they weren't on a spaceship, they were on an ethics committee, which is slightly more boring, but you have to talk to each other, and that's really good. And to do the prep work, to make sure everything's ready for if you do decide to go to Earth, that you don't have to waste all this time doing prep work. And then you talked about the virus like being on Earth, which is like, I would feel like the biggest concern to all of mankind. So that was a big one. And M2, I shouldn't factor your age into this, because it's like everybody should be on equal playing field. But I have to say that you're very, very advanced for how old you are. But I won't say how old you are, because that's private and we won't say anything. But I'm very impressed by that. And that you were the first to speak, so that's really good to be outgoing. And you're still maybe in running for the leader. I'm not really sure who's the leader, because you're all leaders, I think, in this group. And then to protect from aliens, I like that was a good justification for having the bomb on board. And then for asking what does the patient want, because that's like so important. It's like, what if the patient, because he was a doctor, and what if he was like, no, just let me pass away so that I don't potentially spread this illness to Earth? Like, what if that was what he wanted? And we never asked him, so we never found out, so that was good. And then G, you were said to get the patient's symptoms, which is like the best starting point. It's like, okay, we got to figure out what's going on. Let's observe. And I love these said changes in barometric pressure, because circling back to being normal in an abnormal environment, it's like, what is normal for that pressure? So, and then how does the AI work and the advances in the AI? And then you wanted to know that was a great question. How does an AI give somebody a virus? I mean, that's great. And then to see if other AIs from the same manufacturer were also giving other people viruses, that would be a legitimate concern. Could be a fault at the AI manufacturing plant. And then, let's see. I like the stop space colonialism. That would be a valid reason for the doctor/patient for putting a bomb on the spaceship, is to stop space colonialism. So you guys did a very good job, and the doctor lived and nobody got the disease, and the AI got an AI award for its intervention. So yay!
Wait, can I keep clapping for the video?
Yay!
Cool.
I just have A written here. There's two A's, so you're gonna be A1 and A2. Okay. The film is rolling. Okay, so rest assured that you will probably not have to be involved in physician-assisted suicide. Like I said, unless you open up a shop that says physician-assisted suicide found here. You go into peds, nobody's gonna ask you. So I think it can help you sleep at night knowing that it probably won't happen, that you need to actually make this decision, which is, wipe that sweat off. I see you're all getting tense. But it is something that you do have to think about, because it is a common ethical dilemma that is presented to you upon medical school interviews. So maybe now you're sweating a little bit more, but at least it'll all be hypothetical, because if that is not something that a field you want to get into, then you just go into another specialty, right? So on the lines of that very classic ethical dilemma, which I just learned is now more of a dilemma than it was when I was in medical school, because the number of states that it is legal in has clearly risen since then. So A1, I liked that you addressed Miriam and I by our names. There is a book by Dale Carnegie, or Carnegie, depending on how you want to pronounce his last name, called How to Win Friends and Influence People, and you should all read it if you want people to like you, because calling people by their actual names is one way to make that connection. So keep doing that on your interviews. And then the other thing, so this is actually the first time we use this topic, but there are just certain things like capacity that are check marks in my mind that I want every group, at least one person from each group, to bring up. And so I have written down some of the things that I'm glad that you brought up. So I like that you pointed out that you can't just give the patient what they ask for. They come in with a list of, they're like, please, Dilaudid. You can't just be like, here's your Dilaudid, morphine, and painkillers. It has to be in what's their best interest. And that gets blurred a lot now with these Press Ganey reviews, because it's like, please review your experience at XYZ hospital. And it's like, I didn't like the peanut butter jelly sandwiches, and the nurse didn't like when I hit on her, so I didn't have a good time. It's a customer service industry. So obviously if they come in with a list and they want all these drugs and you give it to them, they're gonna be like, yeah, best hospital stay ever, 10 out of 10. But honestly, that's not often what is the best for the patient, because then they get discharged and they're addicted to painkillers and they're stalking one of the nurses. so it's hard because you have to balance this like pleasing people but actually like medically treating them, so definitely err on like treating them medically and not just like making them happy, because even in my practice I have a video where it's like, this isn't Burger King, you can't have it your way, kind of like, just not a drive-through. So thank you for pointing out that you can't just fill their laundry list of demands. I mean, if it's plausible to do it, but you have to do what's best in their best interests. So thank you for pointing that out. And I didn't know you did powerlifting. Thank you for mentioning that. We could talk about that later. And you brought up the capacity, which is obviously near and dear to my heart. The psych eval, like, you can't ask somebody to make life or death decisions without determining if they have the ability to do so. They could be doing so under duress, or like a gun to their head, or like somebody could be making them answer things, or maybe they're having like delirium because they've been in the hospital and they're confused and they see like spiders crawling all over the place. So you have to make sure that they're able to make life or death decisions before taking their word at face value. So thank you. I wrote down the Goldstone Align so that I can literally like use that in my practice. So thank you for that. That's a good zingy one-liner. And then asking others for input. I think that you were the first here to like, I noticed that at least with two of the others in your group, like, you specifically asked them their thoughts, and that's good because the whole assignment was working together as a group. So, and then A2, you want to go into biomedical engineering. That sounds so fancy. And then you were talking about rash decisions, and that kind of ties into like capacity to make decisions. How many times have you just kind of made a decision about something like real quick, and then later like, oh, what if it was about your like life or death though? So you pointing out that they need to have some time was a very valuable contribution to the group decision making, because people generally do better if they have more time to think about things, especially if it's something like life or death. Not like, what is it that you want to eat for dinner? That would not be good to sleep on overnight and decide in the morning, because by that time it would be breakfast. But things like this, you said time to process, and 100% on that. And then V, I was, not that me disagreeing would mean that you were any worse at answering or your performance in an interview, but for the longest time I thought you were advocating for completing the suicide, and I'm like, at least he's got opinions, you know. But then when I figured out that you were actually arguing to not do the physician-assisted suicide, things made a lot more sense. So I'm glad we clarified that. I was scared for a minute. And that you wanted to see what the patient and family were saying. Sorry that both of them were going to sue you either way, but that's this hypothetical situation that may not be all that hypothetical once you're an actual doctor, because the patient and family, or multiple people within the family, when you work in the hospital, you'll encounter them being adamant about complete opposite things, and it is such a balancing act to be able to please the whole family, especially when they disagree just to disagree with each other. Family dynamics, I'm telling you what. And then the respecting like the patient's wishes, but also like you were saying, as long as that there's any chance that they could come out of this, you want to take that. And you were the first, and I think only, well, even if you said it, I just noticed if anybody else said the phrase "do no harm," I must have missed it, because you said it, and that's kind of the theme of like physician-assisted suicide against it, is like do no harm, because we all take an oath, and that would kind of be, you know, against that oath. So I'm glad that you brought that up. And then thinking about the chances for survival and like quality of life afterwards. So I guess I would pick Riley for the leader in this group, but it wasn't. Some of the groups, it was like somebody was like very blatantly obviously the leader. And then there was one group where it was like, I couldn't pick a leader, but if I had to pick, I think it would be Riley. But it wasn't like like, Riley wasn't like, we're gonna do what I
If
say.
you're gonna be a good leader, that's about giving other people the opportunity.
I didn't say if the leader was a good leader or a bad leader.
Riley
in
was
the
a leader,
other
but she was
group.
bad at it.
I was like, this person's the leader, but should they be? I don't know. But you all did a very good job. And in this case, the patient lived too. So in every scenario with all of our groups, the patient lived. Yay!
Let's go.
If you find some of these ethical situations to be tricky, here are some places that you can go. None of these places are paying me. That would be unethical. These are just some places that I have found to have good policies, but you got to keep in mind where you're applying to. The top one is the AMA, and they have a good database for looking up things in their code of ethics. That's, of course, for the United States. The one underneath is one for Canada, and the one at the bottom here for the World Health Organization, that is a global code of ethics. So it depends on where you're going, because interestingly, ethics can differ from place to place, but here are some good resources for you. All right, if you're ready for some heavy hitters, here are some ethical situations that I recommend refreshing on prior to interviews. Genetic testing for reproductive decision making. Confidential healthcare for minors. This is something that I deal with on a daily basis. Mandatory parental consent to, and I won't say the word, but it is something that you may be asked about. Physician assisted, again, won't say the word, but at least back when I did interviews, this was a topic that we were asked about at times. And then we have decisions for adult patients who lack capacity. This is important. And then it would also be important for you to learn about advanced directives.